Today we will discuss about sentinel lymph node biopsy. As we all know, from a tumor there are multiple draining lymph nodes, but sentinel lymph node is the first lymph node which receives the lymph directly from the tumor. So you should remember that is the first lymph node which receives lymph directly from the tumor. This is the specialty of the sentinel lymph node. The sentinel lymph node was first described by Cabana, who is a famous surgeon, and in case of carcinoma penis, the sentinel lymph node was first described. That's why the sentinel lymph node biopsy in case of the carcinoma of the penis is also known as the Cabana's procedure. There are other cancers in which the sentinel lymph node biopsy is having established role. These are the carcinoma of the breast, the carcinoma of the penis, the malignant melanoma, the head and neck malignancies, and the vulvar carcinoma. The vulvar carcinoma was recently asked in exam, so you should remember this. Now, what are the indication of the sentinel lymph node biopsy? It's not like that we can do sentinel lymph node biopsy in all the cases of the above mentioned cancers. The indication is there should not be any palpable regional lymph nodes. Means in case of the above cancers, if there is any palpable regional lymph node, we cannot do the sentinel lymph node biopsy. So in case of the breast cancer, there should not be any palpable axillary lymph node. So you should remember this. This is important. There should not be any palpable clinical lymph node. Now, as we discussed what is the indication, now we will move on to the technique for the sentinel lymph node biopsy. It can be done by three techniques. The first is the blue dye technique, the second is the radioactive colloid technique, and the third technique is the combination of the above two techniques. So in first technique, the blue dye technique, we use the 1% lymphazurine, which is also known as the isosulfan blue dye. Other dyes which can be used in this technique is the patent V blue, the methylene blue dye. In case of the radioactive colloid technique, we use technetium 99 labeled sulfur. You should remember all these dyes as they can be asked directly in the exams. The maximum accuracy of the detection in case of the sentinel lymph node biopsy is when both the techniques are combined together. So we use blue dye technique as well as the radioactive colloid technique together. This increases the accuracy of the detection. We will discuss in detail about the procedure of the technique. A dye and a radioactive substance are injected around the tumor or subcutaneously around the areola. This is, we are discussing about the technique in case of the CA breast. So the dye, which means the methylene blue, patent V blue, or the most commonly used is the lymphazurine, that is isosulfan blue, and the radioactive substance means technetium 99M labeled sulfur, are injected around the tumor. We can inject it around the tumor site or subcutaneously around the areola. The lymph node that is immediately linked to the tumor becomes blue because the sentinel lymph node is the first lymph node receiving the lymph from the tumor. So as we inject the blue dye inside the tumor, the dye along with the lymph goes to the first lymph node, that is the sentinel lymph node, and it becomes blue. Generally, in case of CA breast, there are more than one sentinel lymph node. So you should remember this. This can be asked directly, that there can be multiple sentinel lymph nodes. More than one sentinel lymph nodes can be possible. Simultaneously, the gamma probe is also inserted for detecting the radioactivity. As we mentioned above, a radioactive substance radioactive substance, which is the technetium 99M labeled sulfur, is also injected around the tumor or subcutaneously around the areola. So this can be detected using the gamma probe. So the use of the gamma probe is to detect the radioactivity produced by the radioactive substance technetium 99M labeled sulfur. The lymph node with maximum radioactivity will have maximum uptake of the radioactive substance, hence this lymph node is the sentinel lymph node. Similarly, as we inject the radioactive substance around the tumor, it goes along with the lymph to the sentinel lymph node, and so there is maximum radioactivity in the sentinel lymph node. The blue sentinel lymph node will be removed and sent for the pathological examination. We send the sentinel lymph node biopsy for the pathological examination, that is more precisely frozen section. There are two possibilities: either the sentinel lymph node biopsy will come positive for the tumor, that is the tumor has metastasized to the regional lymph node, that is sentinel lymph node. In this case, we have to go for the axillary lymph node clearance or the axillary lymph node dissection. Minimum 10 lymph nodes are to be removed during the axillary lymph node dissection. And second possibility is that the sentinel lymph node biopsy comes negative for the tumor. In this case, we don't do axillary clearance or the axillary dissection. What is the advantage of this? It decreases the chances of the lymphedema, which are more with the axillary lymph node dissection. So by using the sentinel lymph node biopsy technique, we significantly reduces the chances of the axillary dissection unnecessarily, and it decreases the risk of the lymphedema. This is a figure showing the procedure for the sentinel lymph node biopsy. See, we are injecting the radioactive substance along with the dye inside the tumor or around the tumor. Now, after the dye along with the radioactive substance move to the sentinel lymph nodes through the lymphatics, we can detect it by using the gamma probe, which detects the radioactivity. Now, tumor and the sentinel lymph nodes are removed surgically and they are sent for the pathological examination, so then we can confirm about the diagnosis. Now, what are the complications of sentinel lymph node biopsy in carcinoma of the breast? The most common complication is skin tattooing, as we are injecting the blue dye in the skin around the carcinoma and around the areola. So there is a high probability of the skin getting tattooing effect. And most common nerve injured during the sentinel lymph node biopsy is the intercosto-brachial nerve. You should remember these. These are the important one-liners which can be asked in the competition exams. Now, what are the contraindications for the sentinel lymph node biopsy in case of the carcinoma of the breast? As we discussed, the indication is there should not be any palpable clinical lymph node. So, palpable lymphadenopathy is itself a contraindication for the sentinel lymph node biopsy. Other contraindication are the prior axillary surgery, chemotherapy and radiotherapy. Why? Because the prior axillary surgery, chemotherapy and the radiotherapy disturbs the normal lymphatic route, so we cannot detect the sentinel lymph node. And in case of the multifocal breast cancer, also there is a contraindication because there is not any systematic route. Other contraindication is multifocal breast cancer. Other complications of sentinel lymph node biopsy, as we discussed above, the skin tattooing. Other complication is necrosis, the urine discoloration as we inject the dye inside the tumor, so there are chances that it can reach to the urine via the kidney. So there is a urine discoloration, anaphylaxis in case of the hypersensitivity reaction, and most common injured nerve is the intercostobrachial nerve. This is all about the sentinel lymph node biopsy. Thanks for watching tube.